Cough or sneeze, and right now it is hitting a couple of Major League Baseball players. We're talking about hand, foot, and mouth disease.
So there's a New York Yankees pitcher who thinks he got it on a flight, a New York Mets pitcher who thinks he got it by working at a camp for kids. Doctors are seeing outbreaks right now in Indiana, South Carolina, Tennessee, and Virginia. Our medical expert, Dr. Mandira Mehra from SSM Health, is here this morning with her thoughts. Good morning.
Good morning.
I won't gross you out with the details. She's a doctor. She can handle it. But all three of my kids, and I got it 6 years ago, is miserable. We were talking about it yesterday, just in advance of the segment, and everybody was like, whoa, why are you even talking about this? What's going on right now?
Yeah, it's pretty traumatic, Adam, when you are affected by it or your kids are affected by it. And just like you said, it can take out households and schools and now Major League Baseball players. So what happens is it's a very contagious virus called the Coxsackie virus. And so it's very well known for, of course, fever, malaise, sore throat, this rash that basically breaks out these blisters on possibly your hands, your feet, the palms of your hands, and your mouth and your throat. And as we were talking,
that's where I got it. I got it right on my throat. And my youngest too. We couldn't swallow.
Exactly, and that's one of the scariest things here about this disease process is that, especially in kids, because the pain is so bad in the mouth and the throat, they're limited in what they can eat. They go through dehydration, and so we have a lot of tips here for, of course, our viewers in case you do have this. For the most part, it's a self-limiting disease. Right now, there are some outbreaks in the country, but this happens kind of seasonally. Adults are not immune to this, but of course we see it in the under 5 and under 10 age category more commonly. Yeah. Usually by the time we're adults, hopefully we have some antibodies and some immunity built up, but
sorry,
of course, not all of us do. Yeah. But if you are exposed to it, or if you know your kids are exposed to it, of course keep them home from the daycare, the schools, that kind of thing. Decontaminate all surfaces using soap, water. Some hot water rinses are always good, and make sure if your child has it to, of course, keep them hydrated, keep the fluids going.
Yeah.
Poor guys.
Yeah.
It was not a pleasant experience.
Oh, my goodness. Wanted to switch gears, Dr. Mehra, and talk a little bit about something that the state's been dealing with, and that's deaths by the fake marijuana out there, the synthetic synthetic weed. And you know, what makes this stuff so dangerous? And I guess I'm sure a lot of people are wondering why it's legal, you know?
Right, exactly. And so, you know, of course, marijuana right now is a very hot topic in the country, as well as medicinally, and that's a whole different topic. But the fake marijuana, the synthetic weed, is really crucial here to talk about because it's killing people. Now, we've had a number of cases in the country where basically what you're looking at is substances of dried plants that are sprayed with these different chemicals. And so the side effects every few months now are changing because those chemicals are different. One of the main chemicals in there is actually a rat poison. So I know we talk about warfarin, which a lot of patients are on. Coumadin is the other name for it. It thins your blood. That too is a rat poison. Take that rat poison and make it times 10. And so what ends up happening is if you're using this K2 spice, basically any synthetic or fake marijuana, you're basically getting exposed to this pesticide or this severe type of chemical that stops your blood from forming clots. And so what ends up happening, you could get a paper cut, you can start vomiting blood, you could be coughing up blood, you could notice it in your urine or your stool. If you have been exposed to K2, if you've taken it or you're thinking about taking it, first of all, don't. Secondly, tell your doctor because you may not be in the clear even if you have not manifested signs and symptoms. Your doctor will do some lab tests, possibly give you high doses of vitamin K. It can be life-threatening, so definitely try to stay away from this.
First death reported in Wisconsin yesterday in the Milwaukee area, just something to obviously keep up to speed on.
And about 32 cases just in the state, and if you look at the tri-state area, you know, over 50, 60 cases already.
Wow. It's good to see you.
Nice
Dr. Mehra from SSM Health. Thank you.
Nice
Appreciate it.